Very good. So I am very happy to be here. Actually, my plan was to attend the conference yesterday, Diagnostica, and my younger brother Harish ji hai na idhar, or my sister Shilpa Tora hai na idhar. So when I am coming to Pune, I always feel that I am coming to my own home. So that is the thing. Vasudhaiva Kudumbakam is the concept of Ayurveda. I think you know. Vasudhaiva Kudumbakam. So I never feel that there is difference between Thiruvananthapuram and Pune. For an Ayurvedic person, everywhere it is a family. Do you believe? So that is the merit of Ayurveda. When you learn Ayurveda, you will be getting money, you will be getting fame, you will be getting so many other things. But you are getting so many other things. Kujit dharma, kujit maitri, kujit yashaha, karma phyasa, kujit chedi, chikitsa nasti nishphala. So I am very happy to be here again, and I won't waste any time. I will be talking about the diagnosis and management of psoriasis for the next 1 hour. See, as a physician who is working in a government college in Kerala, I often feel that it is a very challengeable thing to treat patients in the government sector. You know why? Because you are getting only limited number of medicines. Patients may not be able to buy all the medicines which are in your Manovaha Srodhas. We will be feeling that this medicine is better for this patient for this time, but patient may not be able to get that medicine. Then what we will do, we will make so many adjustments in our Dhi, Dhriti, Smriti, and we will go to that medicine which is available and waiting for my prescription in the shelf, and which I will connect to the patient with assessment of Agni, Kushtha and all the things. So it is a challenging job. And when you treat psoriasis, I can very frankly tell you, it's a notorious disease for remission and relapse. It's a notorious disease for remission and relapse. You treat it, the patient will be getting relief after 1 or 2 months of time, because classical Ayurvedic management treatment in skin diseases takes time. Once the patient is getting benefit, he will be happy, but you have to keep vigilant. At any time, by exposure to certain climatic factors or certain ahara vihara, the disease can come back. So I always feel very much vigilant when I am treating psoriasis, even though we deal with all the systemic disease in our regular clinical practice. So I will tell you, my dear junior friends, my dear junior students, or my dear junior brothers and sisters, I am telling you, practicing with the psoriasis needs that much of alertness. You should be that much careful with all the clinical inputs from the patient, and you should be ready to change your decision frequently according to the Vyadhi Avastha. I think you are getting my point. Vyadhi Avastha. So now we will go to the slide. Next slide, please. No need of any introduction regarding the first slide. Non-infectious inflammatory disease. Actually, it is an autoimmune disease. I can tell you why it is an autoimmune disease, because you are getting premature growth of the cells in the superficial epidermal layer. Normally, the superficial epidermal cells will take 30 days to mature. But in case of psoriasis, they will be maturing within 6 days. So there will be overcrowding of cells in the epidermis. So we are getting scales. So Adipravarti of Vada dosha is there, because Vada is responsible for cell division. According to my humble belief, Vada is responsible for cell division, and there is excessive Vada Pravarti, and you will be getting cells which are mature within 6 days instead of taking 30 days. So there will be overcrowding of cells. So that is the cardinal Sambrati in psoriasis. Next slide. You can see both skin, hair, nail, all are affected here. I was very wondered to see why psoriatic arthritis follows psoriasis. See, then only when you understand modern medicine, you will start respecting the Ayurveda very well, because every time you want some modern inputs to tell that your Ayurveda is correct. Do you believe so? Nowadays, if I am telling that according to modern this point is there, then you will clap for Ayurveda. If I am telling purely in Ayurveda, you will not believe. I am telling one example, I think again in Maharashtra, only in some GIT conference, I was presenting a paper regarding IBD, inflammatory bowel disease. Then I told that inflammatory bowel disease people will be getting the problems of anemia, and most modern doctors were there in the venue. So there was a combined panel discussion, and then I told these modern doctors, I told them that according to Ayurveda, when there is inflammatory bowel disease, there will be problem with the mucous membrane of the intestine, and you will be getting eroding of the cells, by which the absorption of the vitamin B12 will be affected. That everybody know. But this vitamin B12 is an absolute component for producing renin and renin, especially erythropoietin, renin, etc. And erythropoietin is a hormone produced from the kidney. I think you very well know. Erythropoietin is produced from the kidney, but to produce erythropoietin, you need vitamin B12 from the intestine. Then I told my dear people in Ayurveda, we very well know anemia can be due to iron deficiency, but the primary treatment of anemia in Ayurveda, please focus, the primary treatment of anemia in Ayurveda is Panduvamayi Pibedado Sarpur Kalyana Gahvayam Panchagavyam Mahadiktam Sadamba Aragvadadina. You take Dadimadi Grida first to the, you give Dadimadi Grida to the Pandu patient. You are not going to give any iron supplement like Mandura Vadaga, Navayasajurna straight away. Why? Because once you heal the mucosal damage of the intestine in IBD by the Grida Kalpana, Dadimadi Grida, better absorption of the vitamin B12 will be there from the intestine, which will take the helping of producing erythropoietin in the kidney, then anemia can be treated. Are you getting me? So you are treating the intestine by a Grida Kalpana, then you are telling that I am treating anemia. Then the allopathic doctor told me, do you believe that all these things are there in your Ayurveda? Then I told, sir, whatever you are telling, IBD, problem of absorption of vitamin B12, production of erythropoietin in the kidney and helping RBC, we have embedded in one single line, Pitta Pradane Kuvida, Idokte Rosha Kovane Mala, and Pandovamayi Pibedado Sarpur Kalyana Gapayam. Are you getting me? So, itna beda points modern medicine mein bataya hai. If you analyze with the Sukshma Buddhi of your Ayurveda, you can see this is the logic. If I am not telling this modern story, you will not clap. That is the problem. If you are not telling IBD, vitamin B12, erythropoietin, you will never clap for anemia and Dadima Digrada. Poor Dadima Digrada will be taking rest in the shelf in the museum. So that is what I am telling, my dear. Everywhere apply your Sukshma level of Buddhi. Now why I am telling this means I have traveled everywhere in India for more than 50 times, everywhere in a place. I could see whenever you tell modern medicine, Ayurveda is getting confidence. I will tell you one simple thing regarding psoriasis. When there is psoriasis and psoriasis is leading to psoriatic arthritis, what is the logic? According to Ayurveda, Kesha, Loma and Nakha are connected. Tokkus, Kesha, Nakha are connected, and when there is an Asthi Pradoshaja Vyadi, Kesha Nakhas will be affected. And according to Ayurveda, the psoriatic arthritis coming under the Sandhi, Asthi, etc., where nail and hair will be commonly affected. And the best treatment for psoriatic arthritis in Ayurveda, as per my practice, is providing Snehapana with Guggulu Tiktaka Grida. Guggulu Tiktaka Grida is a medicine which is applicable for arthritis and Kushtha. Tasyevidam Pradamadi Prabalam Savidam Sandhi Asti Majjagadam. The deep-seated arthritis and the deep-seated skin disease both can be addressed by Guggulu Tikta Grida. That is very much applicable in psoriatic arthritis. So, from my experience, I can very well tell you, psoriasis will be affecting the skin and hair and all the other tissues. Next. Increased epidermal proliferation due to excessive division of cells in the basal layer, already I told you. Etiology, basic defect remains still unknown. Genetic, biochemical, immunopathological, stress and drugs are always considered. Stress is a very important finding. In most of the psoriatic cases, we will be doing Takradara. You know, Takradara is the medicated shower by using medicated Takra, buttermilk. We will mix Musta, we will mix Eladi Churna, we will mix the Triphala Churna and similar drugs with the Takra, and Takra Dhara will be done in the scalp. You know, scalp is a very important site for psoriasis. Scalp is a very important site of psoriasis. So, Murdini, it is affected. So, you need Takradara, and Takradara has got proven effect in stress management also. I am telling 2-in-1, Takradara has proven result in the cortisol level concentration. There were studies where if you do the Takradara, it can be having effect on the cortisol concentration and thereby reducing the stress. And same Takradara is effective in scalp psoriasis. How you are doing Takradara? You will keep medicines like Eladi Churna. Once I went for a program in a hotel. I was the speaker. I came earlier. The person who was arranged in the hall was not knowing me that I am the speaker. I was sitting there only. The organizers have to come. Then another person came and he told that you remove all the chair. That notorious speaker has the habit of going everywhere in the audience. So you arrange the seating like a... That notorious speaker was listening all the thing only, and I did the same only. Okay. So what I am telling, so when we are doing Takradara, I will tell you the best yoga is Eladi Churna. My dear friends, there is a wonderful yoga in the Ashtangradayam Shodhana Graha Adhyaya, chapter number 15. Eladi Ganam. You know what is Eladi Ganam? Eladigo Vatakapo Pranamcha Viniyachadi Varna Prasadanaha Kandu Pidaga Koda Nasana. So you soak the Eladi Churna overnight with the buttermilk. Next day filter it and do for the Takradara. That is very, very important. And I can tell you, I can assure you, do it. Money back guarantee, I am telling you. Eladi Churna with the buttermilk Takradara is very good against scalp psoriasis, and Takradara itself is a good treatment against stress. Next. This is what I told in the beginning. In psoriasis, an activated immune system triggers the skin to reproduce every 3 to 4 days. I am telling every 3 to 4 days, building up on the outer layers, and the epidermis thickens, blood flow increases, and reddens in the skin and silver grey scales. You know, the vascularity will be increased in the active phase of psoriasis. You know, I am telling you the vascularity will be increased in the skin in the active phase of psoriasis. That is why you are getting Auspit sign. I think you are familiar with Auspit sign. AUSPIT. What is Auspit sign? If you remove the superficial layer of the skin, you can see the pinpoint hemorrhagic red spots. They indicate that psoriasis is very active. The vascularity, Toksara, Rektasara are very much deranged in psoriasis. I am telling you, Toksara, Rektasara very much deranged, and this is directly seen in psoriasis. Next. Then coming to the classification, everybody know plaque psoriasis, that is the commonest one in Indian population. Erythrodermic psoriasis, gutted psoriasis, pustular psoriasis, and inverse psoriasis are the very common thing. I will just show the picture for you to have an idea. Next. The most common form of plaque psoriasis is seen in the picture. You can see very big, large plaques. Not small plaques, very big, large plaques, very abundantly seen in the trunk and other area. Commonly seen as red and white scaly patches appearing on the top first layer of the epidermis. You can easily diagnose by simple clinical picture plaque psoriasis. Next. And this is stable plaque psoriasis, most common type. Lesions are red with a dry silvery white sealing. That is dry silvery white layer. It is mentioned in Sidhma. You know Charmakushtha. Ayurveda is telling so many different types of Kushtha. One important type is Charmakushtha. It is clearly mentioned that is the beauty of Ayurveda. Sidmam Rucham Behi Snigdam Andaha Krishtam Rejahat Kire. My dear junior friends, try to learn the classical points in Ayurveda in a systematic way. You never feel that slogas are shoga karanam. Do you believe so? Slogas are shoga karanam. If you learn sloga, there will be shoga. No, slogas are saukhya karanam. I am telling you, what is Sidma? Sidmam Rucham Behi. Externally it is Rucha. Snigdam Andaha. Internally it is Snigda, and Krishtam Rejaha Kire. If you scratch it, no, it will lead to silvery powdery dust. Silvery powdery dust. So very beautiful morphological explanation is given by each Shastra. Are you getting me? If you read in between lines, the problem I will tell you, we are feeling that these slogas are complicated Amazon jungle. That is your feeling. Am I right? No. At any time you have a red Sidhma, my dear, tell me, I can't see you because of this light. Have you seen the sloga Sidhma in your Samhidas? Yes or no? Yes. Then what is the morphological pictures of Kushtha in every science? Then you will feel that sloga is sitting in front of you. Sloga is sitting in front of you, because then only you will feel confident that all the slogas are right. Now you will be feeling that slogas are some Sanskrit line. But when you see the patient externally Rucha, internally Snigda, when you scratch, there will be the silvery white powder. Immediately the picture will be coming to psoriasis. Are you getting me? And then the next line is Prayena Murdakayesya. It is mentioned that it is Prayena Murdakaya. It will be more seen in the Scalp. So all the words mentioned in the sloga are supporting psoriasis. The problem is we learn psoriasis in modern medicine and we go for Ayurvedic treatment in Ayurveda. That is the problem. You learn psoriasis in Ayurveda by Sidhma-Kushtha, Eka-Kushtha, like that. It may be Eka-Kushtha, it can be Sidhma-Kushtha, but both are Vata-Kapha. My dear, please come with me. In Kushtha chikitsa, today itself after my class, you should go to Kushtha Nidana of any Acharya and study what are the dosha domination of different Kushtha. Yes or no? Yes. You should do it. Okay. Now I will tell you, Vadena Kushtam Kapalam. Kapala Kushtha is Vadiga only. Pitta Audumbaram. Audumbara Kushtha is Pitta only. I will come to the point. Charma, Eka, Kushtha, Kitibha, Sidhma, Alasa, Vipadika, Vadasleshmotava. Are you getting me? So Charmakushtha, Eka-Kushtha, Kitibha-Kushtha, Sidhma-Kushtha, Vipadika, Alasaga are coming under Vata-Kapha. What is Vata-Kapha? Vada is Ruksha, Kapha is Snigdha. But in Sidhma-Kushtha, externally Ruksha, internally Snigdha. That is very well told by candle grease side. Yes. No, if Devi Putra Samhita is telling candle grease side, you will salute. Devi Putra means Devi son. But our poor Vakpada is telling Sitnam Rusham Begisikdam. Oh, what sloga it is? Slogam Sloga Karna. Are you believing like that? My dear, I am telling you, Sitnam Rusham Begisikdam. You remove the superficial plaques of the cells in the scale, you are getting candle grease appearance. That candle grease appearance told by Harrison and Davison is same thing like that. Sitnam Rusham Begisnikdam Anda Krishtam Rajat. So I am telling you, psoriasis is coming under Vata Kapha Kushtha generally. Point number 1. That is why I told you Vata Kaphagara Churna, Eladi Churna is good against scalp psoriasis. Point number 3. Takram Ledu Kashayamlam Dibanam Kaphavadajit. Takram is the best agent for external application when there is Vata Kapha. Are you getting me? So when we learn Ayurveda in Dravadrivyadi Vijnaniyam, we never learn Takra. We learn Takra only if we drink Takra. Takra can be given externally. Takra is externally Vata Kapagara. Eladi Churna is externally Vata Kapagara. Psoriasis is coming under Vata Kapagara. Combine Takra with Eladi, apply in Murda, scalp psoriasis guarantee. Are you getting? This is the connectivity of the science. This is the connectivity of the science from one sloga to other sloga to other. So that is what I am telling. Stable plaque psoriasis. Next slide. So plaque psoriasis, you can see generally it will be seen in the extensor surface. Wherever there is roughness is more extensor area, the plaque psoriasis is more on the extensor surfaces. Next. And the features, it is characterized by large flat areas, plaques of psoriasis with a typical silvery scale. These plaques, see it is mentioned as Prayana Dautiga Pushpavat. Ayurveda told the silvery scaling as Dautiga Pushpavat. And these plaques may join together to involve very extensive areas of the skin, particularly on the trunk and limbs. Plaque psoriasis is more commonly seen in the trunk and limbs. It is often accompanied by scalp and nail psoriasis. Never forget to examine the nail of the psoriasis patient next time. I will tell you, I am telling one thing from my experience. If you see the nail and you can see the nail pitting, small pitting will be seen in the nail, no doubt that they will be getting psoriatic arthritis. I can assure you, more than 30% of the people suffering from psoriasis will be getting psoriatic arthritis in the future, and the commonest warning sign is nail pitting. And that is what I told you, Kesha, Nagas, Masru, etc. are very much connected in Ayurveda. According to modern also, they are telling nail pitting will be the warning sign of psoriatic arthritis. Next. Again, you can see the external Duchada. Do you want any more image? Externally, it is that much Ducha. I will tell you, after giving the primary treatment in psoriasis, when there is excessive Duchada there, we will apply Yamaga Kalpana. You know what is Yamaga Kalpana? There are Chadurvida Sneha. Am I right? What are the Chadurvida Sneha? Sarpar, Majja, Vasa, Thailam. If you combine any two, it is called Yamaga. If you combine any two, you will be calling it as Yamaga. And one famous Yamaga Kalpana available in the practice is Jivandhyadi Yamagam. You read it, it is available for all the companies, especially in all the Kerala companies are having Jivandhyadi Yamagam. Jivandyadi Yamagam is applied externally when you are getting this much of hardness. So that is why this picture in your right brain and Jivandyadi Yamagam in your left brain. Guaranteed? Yes or no? Yes, my dear, when you get a picture of this much Rutshada, think about Yamaga. I will tell you the mathematics in Ayurveda. Do you believe that in Ayurveda there is mathematics? Yes. Do you believe in Ayurveda there is mathematics? After having starting Ayurveda, everybody will forget to know mathematics other than the dose only. I am telling you, sharpen your brain, sharpen your brain. What do you mean by Ruksha Guna in skin? Yasya Shoshane Shaktisa Ruksha. I am telling classically. Yasya Rutshane Shaktisa. Yasya Shoshane Shaktisa Ruksha. So wherever there is Ruksha Guna, the skin will be Shosha dry. Rutshana in the Kushtha will lead to constipation. Rutshana in the stomach will be leading to xerostomia. Rutshana in the eye will be leading to xerothalmia. Rutshana in the skin will be leading to dryness. Agreed? So Rusha plus in the skin, dryness. Rusha plus in the skin, dryness plus scaling. Rusha plus in the skin, dryness, scaling plus cracks. Cracks will be developed. So this is the Amshamsa Kalpana in Ayurvedic mathematics. Here you are getting not Rushada double, plus. If the cause is Rushada plus, the management will be Snigdada plus, combine two Sneha, Sarpur plus Taila, think about Ayurveda, remember Jivandyadi Yamagam, write it, you will feel the Hasta Gauravam. You know what is Hasta Gauravam? Hasta Gauravam is Samyas prescription Lashana. My own slogan. You know, when you confidently write a prescription using all the knowledge in your mind, then naturally you will feel. After writing the very good prescription, I will make 2-3 underline. My patient know he is enjoying his prescription. Are you getting me? That is what I am telling. Ayurveda is about to jnana, that is called buddhi. Jnana to buddhi, jnana to bodham. Jnana everyone can have. But from jnana to buddhi, that is the art and science of Ayurveda. You will feel this much of practical analysis happened in your mind within 2 to 3 minutes. Are you getting me? Yes or no?
Yes, sir.
So, okay, so that is what I am telling. When there is externally double Ruksha, you need externally double Snigdha, Yamaga available, Jivandyadi Yamaga, prescribe it. You know, I told you so many things from Panchakarma, Nidana, fundamental to tell the answer. We are discussing about the psoriasis. I took you to Dravadravya Vijnaniyam, Sutrasanam. I took you to Sneha Vidhi, Panchakarmam. I took you to Nidana Sanam, Sidhmam. Then I told you to Hariputra Samhita, Devi Putra Samhita, Harrison Davis' plan, everything. Then I told you the prescription. So Jnana is only one thing that is always processed in your mind without any bias. Okay, next slide. So plaque psoriasis, another picture. Here you can see extra more vascularity is there. Where there is more vascularity, Rekta Varnam. See, Ayurveda beautifully told Tamra Tok. You know, Tamra Varna Tok, that is indicating more erytherodermatous appearance. And here you have to add something which is Rekta Shuddhigara, Sharibadi Kashayam, Aragvadadi Kashayam, both are good. Sharibadi Kashayam, extreme Pitta Shavanam. Shariba, Usira, Kashmirya, Maduga, Sisira Doyam, Chandana, Rekta Chandana. Shariba, Usira, Kashmirya, Madhuga, Sisiradvayam, ST Madhu is a very good drug to cause Rekta Shuddhi, Rekta Prasadana, Pitta Shavana. Glycyrrhizia glabra, ST Madhu, a very potent drug, and that is why Sharibadi Kashayam. When you see that there is Kapha with Pitta, think Kapha with Pitta and Rekta Dushti, think about Ayurveda Kashayam. For everything Ayurveda is having medicine. The problem is to identify. I was telling to Pavanji in the morning, there are medicine for everything. Only problem is identify what is the Vyadi and what is the Vyadi Avastha. So that is what I am telling. So this is plaque psoriasis. When you are getting a picture with more vascularity, Rekta Dushti, Tok Tamra Shava Lohida, you think about what? Charibadi Kashayam and Ayurveda. I am telling you the Hetu, telling you the Linga, telling you the Aushadha also. Because I am not telling that Aushadha will be there. Aushadha will be always along with the disease only. Next. Again you can see. No problem, madam. No, I know. Okay, thank you, Shilpaji. Shilpaji, no, when I am getting Khanda Roda. Thank you. So again another picture only, different gradings. Next. And this is the picture. See the scalp. See, Ayurveda beautifully told that Prayena Murda Kayesya. What was the need? See, Ayurveda never told a skin disease in Shiroroga. See, Ayurveda described Kabala Roga separately. They told Daru Naga, dandruff, everything. But they never told a skin disease. They told skin problem and hair problem in Kushtha chikitsa only. I am telling you, when they are telling about Sidhma Kushtha, 1.5 line is exclusively for this picture. Prayena Murda Kayesya. You see, when you read, the next time I am giving you a challenge. Next time when you read every classical sloga, such images should be on the right side of your mind. Yes or no? We are reading slogas without any image in our mind. Oh, no, we are thinking only about the grammar and the Sanskrit of the sloga. Go beyond that. Have a clinical picture in your mind. Next time when you read Sidhma Kushtha, you should have an image in the mind that there can be Prayena Murda Kayesya. Murda Tailas are very good treatment against scalp psoriasis. I can tell you, if there is more Kapanubandam Takradara, if there is more Vadanubandam Shirodhara with Taila. Very important. My dear friends, Shirodhara can be with Takra, Kapanubandam, seborrheic dermatitis, Kapanubandam, Shirodhara with Kashaya, Shiri Virshatva Kashaya. Extremely good when there is Kapha Vittam. If there is Kevala Pittam, Shirodhara with the medicated Shira. If the pathology is with the only Vada, it is better to have Shirodhara with the Taila. So I am telling you, Takradhara, Kashayadhara, Shiradhara, Tailadhara. Are you getting the difference? Takradhara, Kapha domination, seborrheic dermatitis, Eladi Churnam, scalp psoriasis. Shiradhara, only Pittanubandam. You convert Shiri Virshatva into Shiradhara, do it. When there is more Vadiga, more Vada-like properties are there, you think about more Ruchada, Tailadhara. Tailadhara can be done with Dhanandarandaila, Karpasastra according to your choice. So Kashayadhara, Takradhara, Kshiradhara, Tailadhara can be applied depending upon the dosha domination. My dear, everywhere in Ayurveda, it is dosha only. There is no magic in Ayurveda. Ayurveda is not a magical science, sir. Ayurveda is a logical science. If you know that, if you can establish the cause-effect theory, you are always having the logic, and then the logic will tell you where to use the dhara. Here you can see the scalp is affected with the psoriasis. Next. Again you can see scalp is there, and alopecia, hair loss will be there. Hair loss will be there with the alopecia, and that is also seen in scalp psoriasis. Next. Then psoriasis affecting a fingernail, plaque develops on the nail bed and causing the nail to separate from the bed and become brittle. That is important. The terminal edges of the nail will become brittle. That is the commonest feature with extreme Vada Prakopa in nail. Next. The nail involvement, psoriasis involves the matrix of the nail bed in 50% cases. Nail pitting, that is what I told earlier. Nail pitting followed by onycholysis. You know, there is a disease called Kunakam in Ayurveda. Have you heard about Kunakam, Chippam? Kunagam, Chippam, both are mentioned under Shuddha Roga. From Kushtha, I am taking you to Shuddha Roga, where you are getting onycholysis-like feature. Sadadauda Grudam is good there. If you are getting onycholysis, the Triphala Kashaya will be doing for Chalana, then dry it and then apply Sadadauda Grudam. That is very important. Chalana is very much important with the Triphala Kashaya because that will cleanse the area. The presence of Kleda, terminal end of the nail will be affected. Remove the Kleda by Chalana, Triphala decoction, and once it is dried, apply Sada Dauda Gruda. A very important medicine that can be applied. So you can bring Kunaka Chikitsa, Chippa Chikitsa from Shuddha Roga Prakarana to nail involvement of psoriasis. That is my point. The nail involvement of psoriasis can be, my dear, when you shoot my speech, no, you should shoot in your brain also. No, I am not discouraging. You can shoot it because no, when we are shooting, no, we will be focusing only on the camera. Our mind will be somewhere else. We have to shoot everything in our minds. Why you are writing in the paper in CME? Why you are not believing your mind? No. Why you are writing in the paper? Because I may forget. I may forget. Then never you will remember. I am telling you. You just go to your house and see your room. There are so many files and folders and you know. Never you open it. Yes or no? I normally don't get any time to open it. You are also like that only. So, but you keep writing in your mind, you know, you will remember. I am telling you, Kunaka Chikitsa, Chippa Chikitsa, Sadadauda Gruda, Triphala Kashayam, keep it in your mind. These points I have not written in the PowerPoint. Is it there? How I am remembering? It is part and parcel of my. If I am in the graveyard also, I will be telling like this only. No, I am not joking. So that is the way to think. Otherwise, if you write in a paper, write in a computer, WhatsApp, email, you will be forgetting. So never give the job to Ajayadana mobile. You give the job to Chedana brain. Now, of course, all these chemicals are very good only, but don't give to them. You give it to you only. When you are sitting in the OPD, I am telling. Sometimes I will be having a particular drug in my mind. In OP, especially when I am sitting in my OP days in Wednesday in my college. So I will be having certain affection to certain drugs on certain day. I don't know whether it is explainable or not. I will be having love towards certain drugs on certain day, certain time. It is human mistake maybe. Okay, we can have love to anyone at any time, no? So I will be having love to Guduchyadi. Guduchyadi is a famous drug. I am having Guduchyadi love on Wednesday evening, Wednesday 11 o'clock, but no Guduchyadi patient is coming. Then my PG student will discuss why he is sad. No, he is Guduchyadi not at come. He is thinking about Guduchyadi only. Of course, it is correct. Next day, one skin patient is coming. I will see whether there is any possibility to write Guduchyadi there. I will take all my Manovahas Rodas to see whether there is any Guduji, Patnaga, Rishta, Nanya, Rekta Jandanam, Pitta, Saleshma, Brana, Chardi, Daka, Trishna, Agram, Agrigar. I will ask, is there any problem with Agri? No, sir. Guduchyadi gone. So now I am telling such an affection should be there for you to every yoga, then naturally you will feel that he is in front of you. Are you getting me? Yes. You need not make much inquiry. I am telling from experience. That is what I am telling. If you are so confident with one yoga, naturally when he is in front of you, you will attack and kill. There is no need of any. So that is what I am telling. From jnana to buddhi to that bodha, that is a very important thing. So I will be telling that Shudra Roga Chikitsa can be applied in onycholysis. That example is Tripala Kashaya Chalana and Shadadauda Krida. Next. Nail psoriasis produces a variety of changes in the appearance of finger and toenails. These changes include discoloring under the nail plate, pitting of the nails, lines going across the nails, thickening of the skin under the nail. These are the changes which you can see in the nail involvement of psoriasis. Next. You can see the picture. Next. See different gradings. Next. Then the second type of psoriasis, erythrodermic psoriasis, involves the widespread inflammation and exfoliation of the skin over most of the body surface. It is often the result of an exacerbation of unstable plaque psoriasis, particularly following the abrupt withdrawal of systemic treatment. Next. Please note, it may be accompanied by severe itching, swelling and pain. This form of psoriasis can be fatal as the extreme inflammation and exfoliation disrupt the body's ability to regulate temperature and for the skin to perform barrier function. So there can be secondary infections. Next. This is very important. Third type of psoriasis, Gette psoriasis. This is having some difference from the other types. Usually seen in children and adolescents. Rash often appears rapidly and the individual lesions are droplet shaped. Very, very typical. That picture is so suggestive. Droplet is like appearance. It will not be big plates. You are getting, if you just dip your hand in a paint and sprinkle, just like that, you are getting the droplet appearance. Small red or pink and scaly. Bouts of the psoriasis usually clear in a few months. That is typical Gette psoriasis. Next. Then Gette psoriasis, an acute symmetrical eruption droplet lesion usually on the trunks and limbs, adolescent or young adults, follows streptococcal sore throat. That will be always there. Next. You can see the droplet appearance of Gette psoriasis, mainly seen in adolescent ages. There will be some streptococcal sore throat, some infection may be there. Next. Next. Then the fourth one, pustular psoriasis. This is also called palmoplantar psoriasis. Palmoplantar psoriasis. What is that? Rare but serious type. Onset is sudden with myriads of small sterile pustule. Paga will be there. In all the previous cases of psoriasis, there was no paga. Here you are getting paga and first time pitta involvement. Why Pitta involvement? Singing pyrexia will be seen. So Jwara will be seen with the typical Paga, pustule and Puyam, and that is indicating of Pitta Nibandha. Singing pyrexia, Jwara will be there. Localized form is more common, involving palms and soles. You will be getting more involvement in palm and soles, so it is also called palmoplantar psoriasis. It is also called palmoplantar psoriasis. I believe this is the only one variety where you can see the Pitta involvement, because you are getting Jwara, you are getting Paga, pustules are there. So generally it is Vata Kapha, but in pustular psoriasis, Pitta Nibandha is there. Next. See the typical picture. Have you seen these cases?
Yes, sir.
Very common cases are there, and it will be having all typical acute Jwara symptoms. I always treat such conditions according to Jwara chikitsa and Kushtha chikitsa. There are so many yogas which are indicated in Jwara and Kushtha together. Jwara is a Kushtha pathology, Kushtha is a Bahya Rogamarga pathology, but there is a visible connecting link. There is a yoga, yesterday I told in the diagnostic conference, Vishama Jwara, there are 5 yogas are there. The first one is for Sandada Jwara, the next one is for Sadada Jwara. There is one yoga. Padola, Shariba, Musta, Pada, Kadugu Rohini. See, actually this yoga is mentioned for Sadada Jwara in Jwara chikitsa, but connecting link between palmoplantar psoriasis, and this is the connecting link between Jwara to Kushtha. And what is the yoga? Second line, Rekta Dadu Asraya Sadada Jwara, Padola, Shariba, Musta, Pada, Kadugu Rohini. Why? Padola is very good Pitta Shamana, Bhedaniya, Shariba number one Pitta Kara, Pagakara drug, Musta the best drug for Jwara. Are you getting me? So when you read Sadada Jwara chikitsa, you never thought that palmoplantar psoriasis can be accommodated there. Yesterday I told there, Adada palmoplantar pustular psoriasis, Adhyayam Vyakyasya Idigas Mahuratrayadayo Magashaya. Such a reference is not there. But if you read very carefully Sadada Jwara chikitsa, where Rekta Dhatu is affected, and Rekta Dhatu, the Sadada Jwara is having some skin manifestation, then think about this yoga. Otherwise, this yoga will also sleep in the comfortable museum. You know, all the medicines are simple, no adulterant, simple medicine. Padola, Shariba, Musta, Pada, Kadugu Rohini. My humble ventricular request number 1. Today, after the class, you should go to the house and take Charaka Samhita Chikitsa Sthanam or Ashtangradayam. Same yoga there. Both are same. And Sandadam, Sadadam, 5 yogas are there in 5 lines. Second line is what I am telling now. Padola, Shariba, Musta, Pada, Kadugu Rohini. When I am getting certain cases with fever and skin disease, and I can establish a connecting link between Rekta Dhatu and Jwara, then generally I will depend this area. This drug is not readily available in the pharmacy. If you remember, simply follow the pharmacy drug, what is the role of Samhita, sir? Company people will bring all the drugs. You will always think about Sharibadi, Guduchadi, Padoladi, Arogadadi. Then what about the Padola, Shariba, Musta, Pada, Kadugu Rohini? So then what you have to do, go to the textbook, read it. In my mind it is there. I am telling you, even though I love very much Guduchadi, Padoladi, sometime I will remember this sentence also, then my pen will naturally write. Sometimes our brain will tell you write Padoladi of Kottakkal, Vaidya, Aushadhi, Nagarjuna. But I feel that there should be something more to that Padoladi. Your mind will tell, then naturally your brain will think about the Jwara chikitsa, Kushtha chikitsa, where there is a connectivity. Then I will think about a Jwara, then I will think about a Rekta Dhatu Jwara, then I will think about a Sadada Jwara, then I will think about Sadada Jwara yoga. Then naturally my mind will tell, Padola, Shariba, Musta, Pada, Kadugu Rohini. Patient is happy to prepare the medicine. I will get Hasta Gaurava, he will get a cure from the disease. Are you getting me? Otherwise, whatever you are learning in the textbook will be kept ideal. The message number 2, available yogas are there in pharmacy, but there are simple, cost-effective yogas mentioned in the textbook. Please go to that. Why you cannot refer when patient comes. If it is in your brain, you will remember. Sir, I think the both are different, no? If patient is coming, then how you can refer all the textbook? No, software will help you. But software is your brain. If you know Sadada Jwara, I will tell you. What is the next one? Sandadam, Sadadam, another yoga is there. If there is that much urinary tract infection and Jwara, again so many wonderful Peya yogas are there in Jwara chikitsa.
Mutra Krichra, painful micturition and UTI with all bacterial culture evidence. You can treat with Jorahara, Mutra Krichra, Payad yogas from Chikitsa. Abundant yogas are there. Nobody is writing not even a single yoga. You imagine their depression. No, you simply feel the Aksharas are Brahma. They also have a heart. No, Aksharas are Brahma only, You are telling that Aham Brahmasmi. You see, all these medicines are waiting that Gopakumar will write me one day. NCMs are is there, They are telling that you read Kaya-Kesh, you read Charmakushtha, you have to write in the next dengue fever. Nobody is writing. Think about their depression. I am really, to me, the depression felt in my Manovahas Rodas is equivalent to the depression felt by the most magical Akshara Brahma sleeping in the textbook. No, I will feel. So I will see that I am going to the text, I am unveiling something, I am identifying, I am writing. I will tell you a simple example. Once there was a patient brought to me with hyperemesis gravidarum. Hyperemesis gravidarum was there, and normally I never treat any gynecological case. They went to so many other doctors, and since some of my close friend was related to this patient brought to me, I again sent to some of my very close gynecological friends, and again she came back. And suddenly, when this patient became a Dushi Vichar to me, always following, not going. Dushi Vichar, following like that only. Then I remembered a simple line. Villo Lamatya Lajambu, Pibe, Chartish Garbini, Harish Bhaiya, Maine, Pada, BAMS me. See, when I was studying for my BAMS Prasudandra Vaiva, the teacher was so powerful. She will ask everything, and she know that this Gopakumar know all the sloka. Very difficult. Very difficult. If the teacher knows that he know all the sloka, the teacher will prepare with the Vaiva only, Because now I am a teacher. That was my Duryoga when I was studying in my BA. Okay. All the teachers very well know. I was one of the good students to get all that love from my teachers. Okay. So the day came, my final year Vaiva day. That is Prasudandra Vaiva day. All expert Prasudandra. 4 people are there for Vaiva. My number was 10. Gopakumar, Gidija, Krishnan, Gopakumar, 10th number. 10th number is the last number, so it will take around 5 o'clock in the evening. All others will leave. For all others, I will be giving support because my number is last. My number comes, nobody is there. I will go to the hall for Vaiva only. And again, okay, this lady asked me the chikitsa of hyperemesis gravidarum. I told, I made a mistake, sir. I asked madam humbly, you should not show over humble, that is dangerous. I asked madam, you want to get the chikitsa from Ashtangradaya, Chataka or Susura? A big mistake I committed in 1995 in my final year BAMS. Then she got irritated. Even now, I will be also getting irritated. You tell whatever you know. She told me like that. Then I started with a very humble. I was truly humble. I was not acting. Truly humble. I told the Chikisara, Ashtangradaya, Saraka Samir, everything. Then there is a local book in Kerala that is called Chikitsa Sangraham. Some of you may be knowing. Local Malayalam book in Kerala. I learned some references from other textbook always because I finish all the BAMS topic very easily. So I will go for some reference. Then I told sir, I am going to tell one more yoga. All the 3 teachers are not at all interested. What you want to tell? I can still remember that Vaiva. That you tell. Except one lady teacher. Then I told sir, Villo Lamadja Lajambu Pibe Chabdishu Garbini, where it is mentioned. Then I told madam, it is in Chikitsa Manjari. Villua. You know Villua, Eagle Marvelous Villua. Lamadja, that is the Ushida. And Laja. Only 3 medicine. Very simple medicine. Villo Lamadja Lajambu Pibe Chabdishu Garbini. Garbini, Chardishu, you take this as a paniya, muhur. You cannot give us a such. Muhur. Okay, she told, and she immediately told the PG students to bring the Chikitsa Sangraha and referred it. Oh. Because no, they never cared. I simply studied sir by mistake. NCM se maafi mangta I simply studied. I am telling. I simply studied. Told. Okay. Then she quoted and referred, and I got a 96 mark out of 100. Oh. No, I am not telling the merit of the mark. You know how 96 came. 4 components were there in the practical. 25 mark for antenatal, 25 prasudi, 25 gynecological, 25 Vaiva. They reduced to 1 from all the 4, so I got to 96. Still not breakable by anybody in the Kerala. Okay, so what I am telling, years over, no, 1994, Vaiva over, After some time, this new patient Aushdhi Vichar with the same thing. I remember that old slogan. I simply prescribed it and she got result. Then I believe that this is the reason why I learned that slogan years back. Are you getting me? The patient came in the later episodes of my practice. I studied that slogan by a Durbhagya in 1995. So that is why whatever you learn or whatever knowledge is coming into your way will be for a future application only. Keep an eye like that. Whatever you have to do will be coming to your way, but at that time you may not be knowing that it is for that purpose. If you know, if you identify, then that means your Sattva Guna is increasing. If I am having Tamo Guna, I will never believe that why I am here at Pune today morning. If I am having Rajo Guna, I will be having two reasons why I am here at Pune. If I am having Sattva Guna, I very well know why I am talking in Pune today. So my dear junior student, now whatever you are reading, listening, spending, never think that it is an ama, it is a Srodo Roda. There is a beautiful day of Pajana Dibana with Srodo Shuddhi in your life. Yes or no? This is my humble message. My humble message, whatever you read it today, you will be feeling what is the need of all these things. But there will be a day where all this knowledge will be tested, implemented and evaluated. That is the niyati, that is the decision of Kalam. The best teacher is Kalam. There is no teacher other than Kalam, and the best treatment factor is Kalam. No, according to Ayurveda, after 7 days, Amadura will be converted into Jeevanatura. And Kalam is the cause, Kalam is the effect, and Kalam is the judge, and Kalam will teach you, so Kalam is the teacher. So never get hesitated that why I am learning psoriasis today. There will be a day for you, you will write Ela the Churna Takradala T.S. Kalpesh. Sure, I know, I can tell you from experience. So this is pustular psoriasis. Next. Pustular psoriasis, we can see simple Paga will be there, Pitta Nibandham will be there, and Jora will be there because Pitta Jora, Ushna Tishna Gunas are the Vikalpa Sambrati here. Next. You can see the picture, all the pus pockets are there with the Jora. Next. So this is seborrheic dermatitis with the psoriasis. See, in this condition, we will be using Chandanaadi Ganam or Chandanaadi Yogam and Sharibadi Ganam for Sirodhara. You will not do anything which is Tekshna, anything which is Siddha Vaidya, Chandanaadi Yoga or the Sharibadi Yoga can be done for this Sirodhara in the seborrheic dermatitis. You can see the pustular pockets are there. Next. The last psoriasis, flexural psoriasis or inverse psoriasis. Here what is happening? Instead of affecting the extensor area, the psoriasis will be in the flexural area. Inside the mammary gland and in the flexor area of your elbow joint, it will be seen. Affect axillae, submammary area and genitals. Plaque, smooth and glazed, seen in the elderly. It is aggravated by friction and sweat and is vulnerable to fungal infection. That is very commonly seen in our clinical practice. Next. Then clinical signs, candle grease, and I told you the candle grease sign is nothing other than Snigdam Rusham Begisnigdam. You read Sidhma Roga, Snigdam Rusham Begisnigdam, modern medicine telling candle grease sign. I will tell you, if you have an interest, you read all the clinical features mentioned for diseases in Nidana Sthana, then most of them are similar to the clinical examinations mentioned by Hutchinson's. You make a test today onwards. No, what is the important test for SL, this sciatica? You are doing SLR. You are doing SLR. You read the second line of Drudrasi, Sakti, Ulshebam, Nidurkanadi. Sakti, left. Ulshebam, Nidurkanadi. You read Bell's palsy, modern medicine, and you read Ardhida in Ayurveda, Nishtiva, Parsado, Yadi. If you spit it will go to one side, weakness of the buccinator muscle. Egasya Ashnor Nimilanam. It is nothing other than closis. So what I am telling, in every disease, if you read very closely, you can see there will be definitely modern clinical examination. Again, Jihva Stamba. You read Jihva Stamba, bulbar palsy, what you are getting? Annapana Vakyeshu Anishadasa. I am telling you the slogan, Vakvaki, just clear, just concentrate your brain. Vakvakini Sira Samsta Jihva Stambhayade Anilaha, Jihva Stambasa Tena Annapana Vakyeshu Anishada. 2 line, how much neurology he has included. Just to see, I am not pushing anything. Vakvakini Sira. The Sira, the nerve connecting the Vak Pravarti, the speech. How you are getting the speech? Articulation. How articulation? The muscles of the tongue. Genioglossus, styloglossus, palatoglossus, all the muscles from the tongue only. And the sira, the nerve supplying the muscles of the tongue, stambhayadi anilaha. Paralyzed by vada. Jihva stamba. Tongue will be paralyzed. Jihva stamba. Next two line. Tena anna pana vakyeshu anishada. Three problem. Anna, Pana, Vakya. Anna means you cannot swallow solid food. Pana means you cannot swallow liquid food. Vakya means you cannot talk. You just go and read modern medicine. In Bell's palsy, you are getting dysphagia, dysarthria. Dysphagia means Annavanam. Dysarthria means Vakyeshu Anishada. So every cause, no, it is not a simple blind correlation. Vagbada clearly told that the Adhisthana is Vakvahini Sira. The 11th cranial nerve supplying the muscles. Stambhayade anilaha. Paralysis. Jihva stamba, I am naming. The features are Annavana Vakyeshu Anisa. How much big neurological concepts are there in simple two-line sloga? We never read it. I am 100% sure that any student studied BAMS Vaidya never studied it. I am guaranteed. But you read it. Then only you will see that all the most modern knowledge which we are claiming from the modern textbooks of pathologies are well beautifully described in Ayurveda. You should have that ability to apply and see. So same way, candle grease sign, auspich sign, both are mentioned in psoriasis, are very beautifully seen in Ayurvedic references. Next. Auspich sign, when the plaques are scrapped, one can see pinpoint bleeding from the skin. The vascularity and auspich sign are directly proportional. The active phase of psoriasis can be judged by auspich sign. Next. Koebner phenomenon, the linear progression of the disease. From one area, if there is a friction, it will immediately spread to the other area. That is also showing the Chalaguna of Vada, Koebner phenomenon. Next. Then investigation, throat swabbing, there may be some infection. ASO titer, DNA is B. Skin scrapings and nail clippings have to be examined to exclude tinea. Next. Then diagnosis of psoriasis is usually based on the appearance of the skin. Sometimes it is already clear. The skin biopsy is very important. That I will tell you. Once I had a negative experience in my life. Once I got a psoriatic patient when I was working in Kannur. My boss was a professor was there, I was junior to him, and both of us thought that it is a psoriasis case because lesions were very simple like that only. And whatever treatment we have done, no relief was there. It was a total failure. Then suddenly this patient is always wearing the full sleeve shirt only because it is all the area were affected. And then he revealed that he is working in Baba, so he is a scientist only. Then we got a doubt that this cannot be so. Whatever we have done, sir, no result was there. Literally we surrendered before the disease. Then we had a second option to do the biopsy. It was the squamous cell carcinoma. So don't think that all psoriasis may be the simple psoriasis. That is why the point a skin biopsy may be sometimes needed if it is not responding to the conventional Ayurvedic management. I am telling from my experience. Next. The biopsy of the skin from a biopsy will show clubbed retapex. That retapex is very important. If you do an experimental study in Ayurveda, you can do the skin biopsy, the retapex. That is the ridges are there. They will be positive, and you can see after the Dakradara etc. how the retapex is coming down. So that is the histopathological evidence of psoriasis. Next. Complications, everybody knows psoriatic arthropathy, typically affecting almost all the joints. Next. Psoriatic arthritis, scaly plaques in the skin, prominent on extensor surfaces, scalp involvement, nail dystrophy. Leave it, already we did. The sausage, my dear previous slide, the sausage digits is a very common sin which can be detected in the patient. Sausage shaped digits. I will show it in the next slide. Next. Next. Lifting, splitting of nails, swelling of joints. You can see. Next. This is the sausage digits. You can see on the left side, the sausage shaped digits are a very common feature of psoriatic arthropathy. You see the difference in both. Left side is sausage digits. Next. Psoriatic arthritis of the fourth toe. You can see the shape of the finger, shape of the toe. Next. Next. See, nail changes are very common. Kesha, Naka, Ok. That connecting link is very much established in psoriasis and psoriatic arthritis. Next.
Then coming to Ayurveda, so many things I have told. Psoriatic arthritis, specific dosha domination, specific. Next, this we have already discussed. Next. See, these are some important concepts. Bija Dushti is there. Viruddhahara can trigger Agni Dushti at Dhadu level. That is why Rekta to Asti, Manasiga Bhavas are there. Viruddha Uvakrama. That is important. Viruddha Uvakrama. If you do some wrong treatment also, psoriasis can manifest. And Kala, Desha, Swabhava, climatic and geographical connectivity is there with the psoriasis. Next. Then let us go to the Vigalpa Samrati. Both Ruksha and Snigdha gunas are present in Vada Kapha lesions. Externally Ruksha, Vada, internally Snigdha Kapha. That is the hallmark feature of psoriasis. Next. Then Sidhma. I believe that Ega Kushtha, Sidhma Kushtha are very much connected to psoriasis. Charma, Ega Kushtha, Kitibha. Charma, Ega Kushtha, Kitibha, Sidhma, Alasa, Vipadika are Vada Sleshma. And Kitibha, Ega Kushtha and Sidhma are having striking resemblance with psoriasis. If you consider Sidhma, externally Ruksha, internally Snigdha, Reja. If you scratch Reja Kire, the powdery skin will come. Slashna Sparsha, that is candle grease sign. Thin lesions, Sanu, Sheda Tamra, erythodermatous appearance, and more in the Murda. That is the keyword, Prayena Murtha Gayesya. So these are the points which will suggest to Sidhma. Next. Ega Kushtha, Asveda, Maha, and Mahashaya, and Malsya Shagala Sanipa, resembling the scales. Next. Kitibha, Ruksham, Kina Karasparsha, very Karasparsha, Kandu, Parishudha, and Asida. But all the three belong to Vada Kapha only. So there is no problem in the Vyadi Pratinika Chikitsa and the Dosha Pratinika Chikitsa. Even though the names are different with different morphological appearance with similarity, you forget the Vishesha, you take the Samanya. What is Samanya? All the three come under Vada Kapha Kushtha only. That is the point you make the treatment. Sometimes names are different. Go for the dosha. Here all the three diseases having the same dosha, Vata Kapha. So treatment is like that only. Next. Then different Dhatu, Rekta, Vaha, Srodhas play the key role. Dhatogini. Dhatogini is very important. My dear friends, I will tell you, when I do Snegapana in chronic skin disease, I am telling. When I do Snegapana in chronic skin disease, my ultimate aim is to correct the Dhatogini. It is not for the simple superficial external change which I expect on the next day. No. I wanted to correct the Dhatogini by which the involvement to the bone may be delayed. So the future hidden sthana samsarya, the word is important. The future hidden sthana samsarya to another site can be prevented by Snegapana. People will never do Snegapana nowadays thinking that there is cholesterol risk. But I can tell you, you can do Snegapana beautifully with a very clear-cut protocol having all the lipid profile analysis. I can tell you, Deeptandaragini, Parishuddha Koshta, Pratyagradhadur, Belavarna Yukta, Drudendriyo Manda Jeras Shadayu, Snegova Sevi Purusha Pradishta. Why you are keeping the treatment away from your practice? We tell all the big things, but we never do Snegapana. In psoriasis, my favorite treatment is Snegapana with Arakuda Mahadikta Grada. Not my case, everybody in my place are doing the same protocol. Deepta Andaragni, Parishuddha Koshta, Pratyagradhadur. That is the meaning. If you are not able to control the autoimmune inflammation in the skin, definitely this will go to the next dhatu. Finally, Asti dhatu will be affected, nail will be Snegapana. I am telling you. I am telling it a clear-cut protocol. You do lipid profile analysis. Before Snegapana, during Snegapana, after Snegapana, 30 days after Snegapana, it will be different for different grada. Tikta grada, Mahadikta grada, Arakuda Mahadikta grada, different profile. So some Sneganas will be increasing kleda. Some Sneganas will be Shosha Karaga. Shosha Karaga Tikta Grada can always be recommended even though you fear from a cholesterol risk. Money back guarantee I am declaring here. You do it. You do it. Tikta Grada I am telling again from my left ventricle. You do with all lipid profile. That is the evidence which you want to know. When there is more kleda, you will be increasing kleda which will be cleared by Shodhana. If you are not planning a Shodhana, never increase the kleda, go for Shavana Sneha. That is why, sir, in Snehana, Acharya told all the three. When Acharya Vagbhada was writing this sloka, somebody had the same debate. So he told, my dear friend, I am telling you three Snehana.
Brahmana Sneganam, Samana Sneganam, Shodhana Sneganam. In Shodhana Snegana, you give Kleda because you are clearing it out. If you are not going for a Shodhana, don't give increase in Kleda. I believe increase in the LDL is Kleda. Increase in the LDL is Kleda, it is just like Ama in the Kushtha. I always tell a common thing, follow me carefully, Ama in the Kushtha is pathologically similar to Kleda in the Recta is pathologically similar to Avishanda in Netra is pathologically similar to Sofa in the Sandhi. I don't know further. But this much I know. Once again, replay. Some shorts you need a replay. Ama in Kushtha, believe, Ama in Kushtha. You understood? Is pathologically similar to Kleda in Recta. Diabetes mellitus visarpa, Kleda in Recta, where we have to go for recta moshana, no snekana, is equivalent to Abhishyanda in Netra. Prayena Sarve Naina Mayastu, Pavandi Abhishyanda Nimittamula. If I didn't get admission to Kayayurved, my idea was to go for Shalakya. But I luckily got to Kayayurved. But see, even then, the Mimi in my heart is there. So, Prayena Sarve Naina Mayastu, Pavandi Abhishyanda Nimittamula. What do you mean by Abhishyanda? The most important pathological word of current scenario. You read Sargandhara Samhita, rarely we read Sargandhara, no? Nowadays, only R&B students will read. I think R&B students only will read. There is a beautiful pathology regarding Abhishyandi in Sargandhara Samhita, chapter number 3. Deepana Padana Vidhi, Paichilyad, Gauravad, Rudhva, Rasavaha Sira. Very, very important. Follow me word by word. Paichilyad, Gauravad, Dravyam, Rudhva, Rasavaha Sira. Datte yad Gauravam Tasyad, Abhishyandi Yadhadati. Anything which will cause atherosclerosis, anything which will be leading to vascular endothelial dysfunction, anything which will be leading to internal arterial luminal obstruction is coming under Abhishyandi. Clearly he is telling Rudhva Rasa Vaha Sira. Rasa Vahanam Srodasam Hridayam Moolam. Coronary artery, angiogram, block. And the opposite is Pramadi. What is Pramadi? You are giving all the blood thinning drugs like aspirin. What is that Pramadi mentioned by Ayurveda? Nijavirena yadrevyam srodebhyo dosha sanjayam nijasya Pramadi. All Leshuna Chidavaga, Silajadu, Marija, Vaja belong to anticoagulant. That is Pramadi. And coagulant and thrombotic is always coming under Abhishyandi. So Abhishyandi will definitely cause Rodha vascular level congestion. Yesterday I told there, no, you read Ashtanga Sutra Saranam chapter 2, I think chapter, never miss chapter 2 and 3. All the intelligent people will read chapter 1 because Aish Kavya. Sara was telling about the Dirkanjividiyam today morning. Dirkanjividiyam, you have to, Dirkanjividiyam is by you have to study longer. The same way Aish Kavya, both Acharyas are same, sir. Yes. Charaga give the name Dirkanjividiyam, Sutra Saranam. Vagbada, his disciple only made it as Aish Kavya. No, I always believe Vagbada was the student of Charaka. So Charaka was the teacher Grantha and Vagbada is the student Grantha. I feel because Vagbada very well told in the last chapter of Ashtanga 120th chapter, he told, I am telling this chapter for Manda Buddhinam like Gopakumar. Because when Mahabuddhi read Charaka, Alpa Buddhi at least read Ashtanga. I am not joking. He is telling like that. Alpa Buddhina. Because no, very, very big things are Charaka is telling. But when Vagbada, he is telling only small thing. And he is telling the same thing only in the second chapter. Chakshus Tejo Mayam. Tasya Visheshal / Manobhayam. I am telling, sir, if you are going to project a movie on Shalakya Tantra, the title song will be like this. Wow. You visualize Shalakya Tantra as a movie. There will be a title song, no? Chakshus Tejo Mayam Tasya Visheshal / Manabhayam. I is vascular, Tejo Bhoda, Agni Bhoda, vision and light, and it will be having fear from only the opposite component, that is Kapha. So you remove Kapha from Agni side, a beautiful concept in Netra Roga. Wherever you treat diabetic retinopathy, the same treatment principle is there. That is what I am telling you. Old Ramayana by Ramananda Sagar. Have you seen old Ramayana? I think when I was 6, 7 or 8 years old, the Ramayana was there. Those who are at 50, remember Ramananda Sagar's Ramayana. Varunastra, Agneyastra is coming from Rama side. Ravana will take Varunastra. That is the same sloka. Varuna means Kapha. Agni means Agneyastra. When there is Kapha in the eye, you give a best Divanapadana in the Netra. That is why all the Kleda, Shoshaga, Tripala drug are famous for diabetes and Netra. Diabetes and Netra, nobody thought that there can be diabetic retinopathy at that time. But Bhagavata beautifully in the Purvaruva told Krinetra Jihva Srabanopadaha Sisa. While telling the Purvaruva Prameha, now we should have a fundoscopy to see that there is changes in the eye. We should have angiogram to tell that there is block in the heart. In Prameha Purvaruva, what was the need for him to write 2 words for Hridaya and Netra? You know the Prameha Purvaruva? Those who are interested in Ayurvedic Prameha, read Prameha Purvaruva by Bhagavata today. I will tell you, when I heard my teacher reciting the Prameha Purvaruva in my second PAMS, that day I definitely took the decision that I will study Ayurveda. I remember my teacher now. I remember the color of the shirt he used that day. You know, in 1992, when he recited the Purvaruva Prameha in my class, Svedanga Ganda Shidilatto Mange Shayasana Swapna Sukhabhishanga. Next line, Krinetra Jihva Srabanopadaha. He is telling a Mutragada Vyadi. He only told that Prabhudavila Mutrada, but he put 2 words are Krin, Netra, Upalebada. How we can identify there is Upalebada in Netra? Now also we need a fundoscopy. Proliferative diabetic retinopathy, non-proliferative diabetic retinopathy, macular edema, the so-called hemorrhagic spots, we need a fundoscopy. But he told there will be Upalepada in Netra. He also told Upalepada in the Hridaya. Now only we know that diabetic people are having that much risk of developing coronary artery disease. So what I am telling, it is very important that all the fundamental problems of Dhatogni correction is very much important with the Snehapana. I will tell one sentence, or I will finish within 10 minutes. One important thing I will tell you, I cannot avoid this telling. In every conference, sir, I will decide, but I will forget. Today I am telling. There are 3 ways to learn Ayurveda from my experience. I had undergone all the 3. I will tell you the merit and demerit of all the 3. Just sharpen your brain. Your younger generation is important. When I was studying in Kayayurved department in Trivandrum Ayurveda College, you very well, I think Pavanji very well know, it's a very big institute. Every time you come to Ayurveda College Trivandrum, 400 patients will be IP at any time. Nobody bothers. 400 cases are treating and going only. So I studied Kayayurved there. Every treatment we learned from there only. That time I was an Ayurvedic terrorist. You know Ayurvedic terrorist? Atangavadi Ayurvedic hoto kya kaise hota? So I will never accept any modern. My teacher will tell upper motor neuron lesion is there, it is lower motor neuron lesion. I will ask my teacher. I had that courage to ask my teacher, sir, upper motor neuron आपको देना है अष्टवर्गम, lower motor neuron में देना है आपको महारासनादि, इसमें क्या फर्क है other than Avarna and Dadushaya? So I was an Adangavadi in Ayurveda. I was up to date in Ayurveda. Of course, I very well know everything in modern, but not at all interested. That was my first way of learning from 1995 to 2005. Then I wrote my PSC examination. I got a job in Roga Nidana. And the government told me, learn Ayurveda in Roga Nidana. Second PG, they gave me a deputation. I started studying Roga Nidana as a fresh PG in my teaching career. I started learning from cell injury, basic pathology, everything. In 95, when I was a teacher in Roga Nidana, then I identified that there are certain things in upper motor neuron lesion and lower motor neuron lesion. Okay. Then I thought that upper motor neuron, prana anubandham, lower motor neuron, abanubandham, pranagara, so many things were coming there. That was the Gopakumar 2005 to 2015 or even up to 2020. But now I am 50-year-old. Okay. Now I am thinking, if I don't know all the modern medicine also, I will write the same medicine only, because I had undergone these both steps. If I am getting a patient with serum uric acid high level and I am getting the Rugraga Toda Daha in the Bitto, I will write Sadavari, Chinnajuhadi, Kogila Shakashayam, Jadugadi, Danya Mladara, and patient will get. Later only I will come to know that it is a gout arthritis. So now I am telling, my dear, all the 3 are important. You learn Ayurveda without any contamination. I don't use the word in a negative sense. You learn Ayurveda clearly. My first phase. Then you learn whatever modern, whatever all these mixing you learn. Finally, you will convince that whatever I learned in the second half is okay, but I know what I learned in the first half was correct. But if you never go through the second half, you will never feel that you were correct. I think, sir, are you getting what my point?
Absolutely. Yes, sir.
See, if you never go through the second phase, your mind will be having a doubt that whether you are correct or not. Now I know, I will tell you, my dear, now I will know, I will tell you a simple example. I got a patient in the hospital with, what the case was, BPPV. I never heard the diagnostic term BPPV. The patient came, so the report was BPPV. I was not at all knowing, having do PG, no user, I don't know what is BPPV. Then my PG student was happy. When the student understand that teacher doesn't know, they will be naturally happy. When the student understand that their teacher doesn't know, they will be always happy. And then my student asked, sir, what is BPPV? Boliye, sir. He know that? I don't know, my dear, I don't know. Then he immediately Googled Acharya Uvacha, Googled, and sir, benign prostatic paroxysmal vertigo. Okay, then I understood it is BPPV, paroxysmal vertigo. No reason is there, but vertigo. Okay, is there? But I asked my dear boy, then you tell what can be given to the BPPV. But Google Acharya has no record of treating BPPV in Ayurveda. Google Acharya disappeared. BPPV Adhyayam Vyakyasyamaka not at all mentioned in Charaka Samhita, Vakara Samhita, nowhere. Over, no? Then student, okay. Then I became confident. It is my time to think. I started thinking. I have to think, no. Then, okay, I thought so many things, and finally, one yoga came to my mind. That was Rushyajivha Kashayam. You know, Rushyajivha, a very proven Pitta Hara yoga mentioned in Jora. You know, Rejaha Pitta Anilal Brahma. You know what is Brahma? Brahma means that vertigo. What is Brahma according to Susruta? Reja Pitta Anilal. Pada Pitta is mandatory with Reja only Brahma, and Brahma is indicated in Rushyajivha. You know Rushyajivha? Now it is summer season, no? Everywhere it is, temperature is high, no? You simply recite the sloka of Rushyajivha, you will feel that you are in an AC room. I am telling you, I am not joking. If you recite this Rushyajivha yoga in a high summer, you will feel that you are in a AC hall. I will tell you that yoga, it is mentioned in Jora Chikitsa, extremely beneficial in all Brahma related Pitta Nibandha liver pathology with the Jora. Just listen. Draksha Maduga Maduga Lodra Kashmiri Sharibaha Musta Amalaga Kribera Patmakesara Patmagam Brunala Chandano Sida Nilovalpala Paruchagam Pando Himova Drakshadur Jadi Kusumavasida Yuktam Madhu Sida Lajir Dayet Kanila Vittajam Duram Madatayam Chardi Murcha Dagam Sramam Pramam Urdagam Rekta Vittanja Pibasam Kamala Mavi. That Sramam Pramam was in my mind. Sramam Brahma and the Rushyajivha Kashayam was given, patient got relief. Then only my dear PG student asked me, sir, what was the initiating point for you to come to Rushyajivha? Then I told Brahmam, Raja Pitta Anidal Brahmam, and Brahmam indication, Raja Pittam, Pittavada Joram, Ashtangradayam, Jora Chikitsa, Rushyajivha. So I got the yoga. Are you getting me? So from an unknown concept of BPPV to a readily available Rushyajivha, this is the knowledge level transformation which we have to occur. Once again, I will tell you, why I am telling you, the third point is important. There is no connectivity between BPPV and Rushyajivha other than my logic. So third logic is important, that is why I am telling third thing is important. I will tell one more thing. One allopathic doctor from in my college, near to my college only, the allopathic medical college, we are in the same campus. Government medical college, government college. So one of the friend from there took one of his friend to my OP, suffering from low back pain. All the normal investigation, all the MRI, everything done, but he is not having any result. No lesion in the MRI, everything. The friend of the doctor, my friend is the friend of the doctor, that another doctor is the patient. Then he told me, sir, if I am telling about my low back pain to anybody, they will tell me that you are psychically ill, because no vision, no lesion are there. They belong to modern doctor only, no? So I will finish very, very soon. Then I started, because they are the modern doctors, is the patient, they don't have any evidence. So what I will do? Then I was thinking to write the diagnosis in the OP ticket, because government college, all bachcho dekhta hai, kya likhta hai? Kya likhta hai? They are watching, no? There is no IVDP, there is no problem. What I will do? And the patient itself is a doctor. The friend, the bystander is also the doctor. Bystander is my friend, but that doctor is, patient doctor is not very good with Ayurveda. Okay. By no Gedi only he came to me. Okay. Then I wrote PGV in the top. When I wanted to confuse my student, I will write in short form. All others are doing like that only. I wrote PGV. बच्चों चिंता करता है क्या लिखता है PGV, they don't know. I wrote PGV only, and the patient was given medicine, Sakadiradi, all the Gandharva and the Kaila, whatever given, and he got relief. Now the point I am telling, after 15 days he came to my OP to get the medical certificate because he belongs to government college, he can get the leave. Then my students told that sir Gopakumar nahi hai, wo CME ke liye gaya hai, ab kal आइए. Then this doctor asked my PG students, कृपया बताइए क्या है PGV, बताइए. I showed this diagnosis to all my fellow people in medical college. Nobody knows. They searched it in Google, Procter and Gamble India Limited, only PGV, nothing other than. आप कृपया बोलिए क्या है PGV. Then my students have no idea, no. I am not there, no. Then they told, वो माँ है ना, ऐसा ही करता है, वो बोलता है, दूसरों को नहीं बोलना, आना मिलता है, not getting others. So next week he will come, you just ask to him only. Next week he came to me, and I had given the patient is suffering from, I have to write the medical certificate, no. Then all are looking, what he is PGV. Then I told, sir, PGV is a disease in Ayurveda. Then this patient doctor got irritated. You tell me what is my disease. I have the right to know about my disease. Then I told, my dear, it is a disease. If I am telling about the PGV, you will be getting so much of worry, so much of confusion, so much of pain. So I am not. No, you should tell. Then I told, no, my dear, you will not be understanding my PGV. It is your PGV, is my PGV, but you will not understand. No, you have to tell because it is my disease. Pakwasiya Krudha Shulana Handra Pujanam Mala Roda Asmardasa Turga Pushta Kadigraha. What? I told you, no, you don't ask me. I told you, no, don't ask me. In my science, I have a disease which your doctors with the scanning was not able to identify. Pakwasiya Deda Vadam PGV. You are writing IVDP in the vertebral disc prolapse. I wrote in PGV, Pakwashe Gadavada, because you are having stone, you are having constipation, you are having Kadigraha, Malaroda, Asma Varda, Satrgabrishta Kadigraha. So I humbly wrote PGV. Okay, sir, I am happy. So then I wrote PGV. Then my PG student all the time joking was laughing only, laughing. Then I asked, my dear, why you are laughing? No, sir. Again, he is laughing only. You tell me why you are laughing. No, sir, I will not laugh. Please tell me. You laugh and tell me why you are laughing. Then he was telling, if a modern doctor is writing IVDP, a second year BAMS student will identify it is intervertebral disc prolapse. But when Ayurvedic doctor is writing PGV, the modern orthopedist doesn't understand what is PGV. But I can understand both, so I am up to down. That is what I am telling. If I am writing PGV, no modern doctor understand, but they write IVDP, I can understand. They write SLE, I can understand. So a BAMS student should feel proud that they know the bilateral spheres of the science. They know Ayurveda, they know modern medicine, but we are so humble that they are telling that Ayurvedic people don't know anything. So that is why from there onwards, I will write only Ayurvedic diagnosis. Because I am an Ayurvedic doctor, my responsibility to write the Ayurvedic diagnosis. Let you ask me, then I will tell. At least I am very happy that I could teach a sloga to an allopathic orthopedician. That sloga even not the BAMS students now study. That person took the sloga, Pakwasiya Krudha Shula Anaha Andhra Bhujanam Mala Roda Asma Vartha Arsa Trika Prishta Kadiga, because it is his disease. First time he identified that his disease is mentioned in Sanskrit words. So that is what I am telling. It is our duty to uplift our science. Okay, no time. So finish. Next. Now we will come to the treatment very fast. Next. Okay, progression of Samprati, Dhadu Vaga, multiple sites. Okay, next. See, these are the important things. Anguli, Sandhi, Shobha, Shula, skin lesions, Tamra, Shava, Lokita, etc. There. Next. Last words, involvement of deeper dhadus make a disease more difficult to cure. Very, very important. Ayurveda has a role to play to prevent further Dhadu Drushti, that is why Snehana, Shodhana and Panchakarma with Rasayana. Next. Now coming to the treatment, these are the three things which I focus in my treatment. Please, only 5 minutes. Vata Kapashavanam, Rekta Prasadanam, prevention of complication. These three things will be in my mind. I know what I have to do. I have a clear-cut aim, I have an objective, I have a roadmap. Don't simply start a treatment, have a very defined roadmap. These three are my roadmap in psoriasis. Next. Next. Snehana, Shodhana, Samana, Rasayana. Next. Can be done prior to Shodhana, can be done Samana, can be done as an external application. That is Snehana. Next. These are the major yoga. I am telling all the yogas with the logical explanation. Tiktaga Gridam, Mahadikta Gridam, Aryabhuda Mahadikta Gridam, Gugulu Dikta Gridam. These are the common. Snehana is must for psoriasis. You may be able to do the external treatment only to some extent only. Dosha kadajit kupyandi jida lengana padane edu samshodane shuddha na tesha punarudbhava is very much important. If you ask me 10 patients, more than 6 patients I will be selecting Aryabhuda Mahadikta. I always do survey upon me. What I have given for the last 10. Aryabhuda Mahadikta Gridam is very good. Kapha Vagagaram without Pitta Prabhavagarakam. Pitta rasas are very much important. And the last one I will generally give us a Shamana Snekabana. If I suspect that he may have a risk of developing psoriatic arthritis, then I will go to Gugulu Tikta Grida because it is good for joint as well as skin. Okay, next. Then Rolo Sedana is must. Next, that everybody know. Then Vamana Vijedana mandatory. If the patient is having average health without any other contraindication of Vamana Vijedana, do Vamana must. Next. Vamana Aushadhi in my practice, please take care. I will show the video now. Madana Pippali, the seed of Madana 2.5 gram, Baja 5 gram, ST Madhu 7.5 gram, Saindava 10 gram, and honey. This is the commonest mixture I am using. I can assure you no complication. No complication I am declaring. If you take 2.5 gram Madana Pippali, Madana Pippali means the seed of Madana, 5 gram Baja, 7.5 gram of ST Madhu, and 10 gram honey, Saindava and Madhu. Sarveshu Vamaneshu Madhu Saindavam Kapha Vilayana Chedanartham Abudishyade. So Madhu Saindavam is important. Next. So many cases I have done Vamana Karma. So many cases. This is a case from a fisherman having deep rooted psoriasis, and we had done Snekavana with Aryabhuda Mahadikta Gridam, and it was treated with Vamana. Very good result. Next. You can see the beautiful Vamana. No Photoshop. You are going to see the video. Beautiful Ganga Pravaha. When you see such a Vamana, then I will be feeling again Hasta Gaurava. Because in Vamana you cannot do anything, sir. You have given the medicine, now you have to only watch. Given everything, your Purva. In my government hospital only, government hospital are having only limited. I think the Kushtha Akinimadya in the mic Akinimadya hua. Because so long time, usko fuel chahiye. Battery. Now always support the Lellada like this. Now you can see the very good bouts of vomiting. Hello. How to do Vamana Karma early morning, 6 o'clock. Kapha Kali Vamana. All the fundamentals are very much applicable here. Okay, dear, close the video, go to the next one. So many are there. You go to Vamana 2. Another case. See, all the full body is covered with the psoriasis, you can see. ST Madhu Panda was given. ST Madhu Panda was given as Vamanovaga Drivya. Then go to Vamana 3. ST Madhu Panda, he was training, so you can see the red color. The capillaries were there, which will be having mild leakage, so it was tints of blood was there. ST Madhu was there. When you are getting the blood stained tin, you give ST Madhu Churna Pradisara. Don't give Eshti Madhurna more than 3 gram, it will cause further vomiting. So there are so many things to learn from vomiting. And after the Vamana Karma, wait for the next 15 days, do one Viryadana Karma. Manipatrakulam, Kalyanakulam, Truthlekam, any one of the yoga can be selected. So the protocol is Snekabana first, Tiktaka, Mahadiktaka, Aragada Mahadiktaka, Guldiktaka, then Shodhana, Vamana or Viryadana. First do Vamana, then Madana Vipali 2.5, Vaja 5 gram, Eshti Madhu 7.5 gram. The Saindava 10 gram honey, then Vamana do the Vamana in the early morning, then wait for the next 15 days, in between have the Shamanaushadhis and then go for the Viryadana, Kalyanakula, Manipatrakula is very good. Manipatrakula is very good even for the Purura Goshta, then you can go for the Shamana. Always the success of Vamana Karma, so success of psoriasis is how beautifully you are doing Shodhana Karma, because in Kushtha chikitsa, Shodhana is mandatory. Okay. Next. See, just a minute. I will tell you, see, sometimes we will be feeling some extra happiness, Yes. When you keep the hand on the lelada of the patient, according to Vamana Vidhi, Upe Parshve Leladasta Vamatas Chasya Dhare. You have to convince the patient very well. No patient will be ready to undergo Vamana because we are doing classical Vamana Karma. He will be vomiting for minimum half an hour without any complication. We are maintaining in our own hospital because it is a government hospital. Only we have all the limitation. But only thing is we have a confidence and the faith in the science that we are going to do it. And what I am telling, when mic is working, or not working. When my sound is there, I don't know whether the mic is working. Okay. You know why this is time to stop. That is mic is telling. Samyak Prabhashana Lashanam. Okay. So what I am telling, now only mic is working. Till now I think I was only talking. Okay, I will finish it. So what I am telling I am just telling as my experience. When you keep your hand on the lelada, you will feel that he is going to vomit. I don't know how I can tell the science behind itself. Why I made a check with my students. I told my dear, you should click the photo before the vomiters land on the basin. All 3-4 students are ready, and then they told sir I told you should not hit the ground. Before that you should keep the photo. Then how? Then I told them that I will give you some clue. I will just blink my eyes because I can feel it. I can feel it, the prana pravarti, udana pravarti, and it is coming out. I will blink. Before that only they click. So many photographs are there. I will tell you, clearly mentioned in Chardi Chikitsa, Udano Viduran Dadun Sarvana Purta Masyadi vomiting. Prana is central vomiting. That is vomiting center. Udana means all the diaphragm, all the accessory muscles which are contributing to the Vamana Veda. You can feel it in your hasta. That is what I am telling. By Sparsana Parisha, you are not only palpating the temperature and the so-called inflammation, even whether he is going to vomit also will be in your hasta. That is, hasta means the Yandrana Mukhyam. I cannot tell you the reason, but I can tell you, I can blink when Udana is ready for vomiting and the click will be there before it lands. That is the beauty of science. I am telling you, all these things are learned from practice only. You should have undiluted belief in Ayurveda. Undiluted belief in Ayurveda, learn it, then definitely it will come to your way. See, when I do such a Vamana Karma, I will be happy, my students will be also happy. You know why students are happy? Once there is Vamana Karma was going on, I was watching whether there is Pitta Darshanam or all these things. He vomited Sirodhara to my head only. Then I will not come for the next hour class, so students will also be happy. I was watching whether there is any Pitta Darshanam in the vomit. Patient was never thinking, Sirodhara to my head only, Gopakumar left, so they will be waiting. Whether today also Vamana Karma is there, because Gopakumar will not be coming for the next hour class. So I am telling, beyond all the normal measurement, when there is a good vomiting, he will be really feeling that we have induced ulkleshana, we have made it out. And when patient is telling, I have so many examples. Once I got a patient with a drug addiction, Dushi Visham, Kalyana Grada Sneka Banam, I have done the treatment, wonderful result was there. We had done all the Medhe Rasayanam with the Eshti Madhurna, and later he won a reality show in TV. So I was very happy that the patient had a drug addiction, Dushi Visham, Vamanam, Kalyana Gradam, and you know why Gradavanam? Grada will always stimulate the higher mental function. This Smruti, and the creativity will be always enriched by the Snekabana and Vamana Karma, and he became champion in the reality show, and he told about the black magic done by Gopakumar in the channel. I could see. I don't know, they made mixed some medicine they gave me. I was not knowing and I started vomiting, but he was not knowing. But then the channel people came to me and asked, sir, what is the logic of all these things? So I am telling, believe in the science and perform it, you will feel happiness. That is what I have to tell. Next. So many things are there. Another case, you can see Pitta Darsana in the lower slides. Typical, so you can see the psoriasis in the all hand and everywhere. Next. Then Viredana Yoga, Trivatulekha, Adivatti Churna and Kalyana Gula. Next. Remember, periodical Sodhana is needed in Psoriasis. That is must. Periodical Sodhana. Once the Vamana Viredana over, no, you can do the Murdu Sodhana drug. You need not do the Panchakarma Theatre Vamana. You can do the Murdu Sodhana. The best example is Kalyana Gula. Or even Manipatra Gulam. That is a Murdu Sodhana without a Panchakarma protocol. Next. Then Payadikrama is must after Sodhana. There are so many simple Payadikrama which can be given to the patient. Next. Then some studies in my department. Eka-Aushadhas are found to be effective in treating Haridra, Nimba, Amrita, Dandapala. All the studies were there in our college. Next. Samana Yoga, Kapavada. Next. These are the common Samana Yoga. You can note it. Tiktaka Kashayam, Mahadikta Kashayam, Guguluta Kashayam, Manjishtadi Kashayam. That is a very good one in Vada domination. Neeli Tulasyadi Kashayam, Padoladi Kashayam, Shonidamradam Kashayam. My favorite one. Shonidamradam Kashayam, Aragodadi Kashayam. These are the different grading. Tiktagadis are more when there is a Rektadushti more, Manjishtadi more, Vadanibandam, Aragodadi more, Kapanibandam, Shonidamradam acute plaque psoriasis. Neeli Tulasyadi Yogam is from Agada Dandra, sir. Sir, I am telling you something. So many Agada Dandra practices are applied for skin disease treatment in our Kerala especially. Because most of the Agada Yogas, they tell that Agada Yogas will be having Rakta Shuddhikara property and they are found to be effective. There is one beautiful yoga called Dushi Vishari Guliga. Dushi Vishari Guliga, sir. That yoga is available. Kerala companies manufacture, that is mentioned in Agada Chikitsa only. I will tell the yoga for you now. Dushi Vishari Guliga, Pippali, Dhyamagam, Mamsi, Lodra, Mela, Vicharchika, Kudam, Nadam, Nadam, Kushtha, Mishti, Chandana, Gedigam, Dushi Vichar Namnayam, Nacha Anyatravi Vaidya. He is telling the last line. I am telling this yoga for Visha, but Nacha Anyatravi na Vaidya. It is not contraindicated for other diseases also. So that point we have taken, and that is a very good yoga in psoriasis like autoimmune skin disease where Viruddhaharas can trigger. Viruddhahara, Visha go together. Viruddhamapijaharam Vidya Vera Vishopamam. That is why I told you Dushi Visha drug addiction. When there is a drug addiction, we interpret with Dushi Visha, go to Agata Dandra Chikitsa. Agata Chikitsa, Bhuta Chikitsa, Unmapa Chikitsa, Visha Chikitsa, similarities are there. Are you following me? Agata Chikitsa, the Unmada Chikitsa and the Manasika Chikitsa like are having that much of importance. One among the Unmada is Vishaja Unmada. When you discuss Unmada 6 types by Vagbada, the 6th variety is Vishaja Unmada, Vishena Shyava Vadana Nashtachaya Hadendriya Vegandarevi Sambradam Prarektashastam Vivarje. So my point is very simple. Vyavayi Vigashi Guna of Visha, Viruddha, which is behaving like a Visha, and Viruddha is a notorious cause behind skin disease. These concepts are very much useful. So I am telling you to read Agada Dandra also for getting better yogas. These yogas are from there only. Next. See, back. The Neeli Tulasyadi Yoga, 1, 2, 3, 4, 5th one is a typical Agada Yoga. Next. Then Kaishwara Gugulu, Aragya Vardhini Badi and Chandraprabha Badi. Next. Manipatra Gulam, Mahadiktaka Gradam, Gugurditta Gradam. These are the Samana drugs which can be given last. Next. Explore further Kushtha Haragana, Nishotamadi Kashayam, Saptasara Gudiga, Gandhaga Rasayanam, wherever necessary. Next. External application, I told you already in the beginning, Eladi Churnam, Gugulu Marijadi Tailam, Vajraga Tailam, Neeli Daladi Tailam. Vajraga Tailam is very good when there is very hard, rough lesions. Vajraga Tailam. Gugulu Marijadi is good whether there is Vada Kapha, equilibrium is there. Eladi again Vada Kapharam. Next. Takra is Vada Kaphasavanam. Takradara is Rodo Siddhigaram. Takradara can prevent the proliferation of cell. That third point is important. Vada Kaphasavanam means the abnormal proliferation will be prevented by Takradara. Enhances Tok Sarada. Takradara reduces stress. Next.
Rasayanam useful to bring Dhatu Shuddhi, reduces the rate of recurrence, promotes repair process, prevents psoriatic complications like arthritis. So there should be Rasayana. Next. Babuji Rasayana, that is Soralia corlifolia. Babuji Rasayana and Tuvaraka Rasayana we generally give. Next. Psoriatic arthritis. Next. Combine Kushtha chikitsa and Vadarekta chikitsa. Next. Snekhavana with Madhyashthyadi Tailam. Madhyashthyadi Tailam is a good yoga for skin disease with joint disease. Madhyashthyadi Tailam. Next. Manjishtadi, Guduchyadi, Kogilakshakam, Bugul Diktakam, Madhyashthyadi are the common yoga where there is skin disease and joint disease. Kushtha, Vadarekta, similarities are there. Rekta Dushti is common to Kushtha and joint disease. Next. Administer Shuddha Roga Chikitsa, Kunaka Chikitsa, I told you Sadadavadakradam earlier. Next. Then coming to last, avoid all abhishyanti diets using Srodha. All abhishyanti diet should be avoided and regular practices of Pramadi diet. Pramadi diet means which will create Srodha Shuddhi. No Viruddhahara, no Vidakiyahara, no more stress and strain. Absolutely mandatory for stress. No Viruddha, no Vidahi. Vidahi will cause Pittol Klesha and Viruddha will cause Rekta Dushti. Both will support pathologies like psoriasis. Next. Some clinical trials at Ayurveda College Trivandrum. Next. Shashanga Lekam. It was a study. Ingredients Samalagi, Bambuji, Chitraga, Pippali, Vidanga and Mandura. Dose 6 grams with 10 ml Tiladaila morning and evening. 45 days. Erythema scaling, induration improved, area reduced, more effect on head. Shashanga Lekam. It is an Indian use from Kushtha chikitsa only Vagbada. Study was there. Next. Comparative study of Guluji, Gugulu Marijadi and Vitpala. This is external Taila. Gugulu Marijadi and Vitpala both had strong properties of anti-psoriasis activity. Next. Tuvaraka Rasayana. Next. Then Vicharchika Deshayamani. Charaka Samhita Sutrasana Vicharchika Deshayamani are there. Chapter number 5. And there it is mentioned Vishagara, Haridra, Mandishta, Sushmail, all the 10 drugs are there. A comparative study conducted with the Kashaya of Vicharchika and Deshayamani and Padola, the Gana Khoda, duration 45 days. Both were effective in reducing the signs and symptoms. Next. So last word, psoriasis is too notorious for remission and this we cannot avoid. This is a universal truth. You whatever treatment you give, if there is apatya for a longer duration, definitely there can be a reoccurrence. So you have to do periodical, episodical sodhana. My humble students, if you believe in classical Ayurveda, my advice number last, not advice, my request number last, you go and take Ashtangradiyam Kushtha chikitsa, last sloga, there he is telling, Pachal Chardanani. You do Vamana, Viredana, Rekta Moshana, Nasya, once in 3 weeks, once in a week, once in a month, like that. Pachal Viredanani, Shudru Mudrahasya Tridatra, Shashte Masi, Asuram Moshana. Because without Sharira Shuddhi, Rekta Shuddhi is impossible. Without Rekta Shuddhi, Tok Shuddhi is impossible. So skin disease treatment is not outside inside, it is inside outside. Are you getting me? You can apply leba etc. very good, but if you are not creating inside out Shuddhi, they may not be having a long standing effect. Who give priorities to Shodhana. That is my last word. Next. So that is the presentation. I am thankful to you. See, actually I will tell you one point from my experience. Every time you empower your knowledge with every latest development in modern medicine, but never keep away from the fundamentals. Read fundamental, read Nidana, read Chikitsa, read Panchakarma, read Dirvyadi Vijnaniyam, and finally I can tell you, you will be feeling a level of confidence in your mind where you will feel that all the chapters are connected. Actually, we tell that Sutra Sthana, Vidana Sthana, Vimana Sthana, all sthanas are different. Actually, there is no sthanas, sir, only Ayurveda. And I will tell you, the ancient Kerala Vaidyas used to tell that if you learn only Sutrasana, you can treat. Because all concepts are there in Sutrasana only. They told that Tatra Rucha Yagu Sida Kara Sushma Stalo Anila. You can identify Ruchada. You can identify. And Pittam Sasnega Dishnoshnam Yagu Visram Sarandravam. Snigda Sida Guru Manda Slashna Mursno Sida Kappa. If you know the properties of Vadavitta Kappa, if you are able to identify in the skin, in RBC, in neuron, in nephron, in liver, and in renin, everywhere, then you are applying Vadasya Upakrama Sneha.
Pitta-Syobhakrama Sarpar and Kava-Syobhakrama Langana and Vamana only. The only problem is drug. Enough drugs are there. I told you know how many drugs are waiting in the queue for your mercy to get written in the paper. Is it correct, no? How many drugs are waiting in the queue? Please, Harish Bhaiya, mera naam bhi likhiye. वो बोलता है पवन भैया जयपुर में मेरा नाम भी लिखिए. ऐसा कितना ड्रग है? We only think about only 5 or 6 common drugs which are handy to us. So many drugs are there. So my last humble advice is there is no scarcity regarding the drugs. The scarcity is regarding the highlight about the drug in our Manovahasrodhas. Are you getting me? Are you getting me? So we should have which is to be the drug given. So I am telling because all of you are students, my humble advice or my humble request is every day spend half an hour with a classical textbook. Please. PLEASE. हाथ जोड़कर बोलता हूँ. Every day spend half an hour with any classical book. Whatever Charaka, Susruta, Vagbada, whatever you understood, please write in a paper, write in a book. And the next day, definitely you will be getting a connection between the previous day. I am telling. As long as you are working with the patient, as long as you are discussing with Ayurvedic doctors, you will be definitely getting a connection. And when you feel that you are getting continuous connectivity, you are getting the real Shastra Abhyasa. Are you getting what I am telling? So today you spend, today evening you spend 5 minutes or 30 minutes with any classical book. Whichever you feel comfortable, you read only, and what you got from the textbook, you write in a diary. Tomorrow you will be having a patient, you will be having a friend, you will be having a newspaper, you will be having a WhatsApp message, you will be having a Facebook post. You will be really feeling a connectivity. Next day connectivity. Continue the reading for 30 minutes. Remember 365 days in a year into 30 minutes. How much connectivity will be there? Can you calculate? 365 days is applicable to Pune and Trivandrum, no? Everywhere 1 year means 365 days. You spend 365 days into 30 minutes. You are having that much of abhyasa. Definitely that connectivity will be there. So my humble request is, Ayurveda is a science which is always getting more and more confidence only by the bodha. You know what is bodha? From jnana to bodha, this is the gap. Jnana means vada is ruksha. Bodha means you are feeling the rukshada in psoriasis, which you are identifying to the level of jivandyadi yamagam. Are you getting me? Yes or no? My dear, you studied vada is ruksha in your first year. You remember your first BAMS class. How many of you remember your first BAMS class in your Manovahasrodhas? Imagine, tatra ruksha vada. Then second year your teacher told you vada is ruksha in psoriasis, Sidhma is ruksha. In final year, your teacher told Jivandyadi Yamagam can be applied in psoriatic lesion. So I am telling the connectivity from Ruksha to Sidhma to Jivandyadi Yamagam. Are you getting me? Ruksha to Sidhma to Jivandyadi Yamagam. This connectivity will be increased day by day. Then naturally you will feel that I am learning Ayurveda, and the feeling of learning Ayurveda is very much important rather than feeling of reading Ayurveda. So beyond all the academical educational system, every day take some time to read a textbook, interpret it, and in your regular discussions include Ayurveda as a regular component without any hesitation. Definitely our ama in the Manovahasrodhas will be digested. We are having ama in the Manovahasrodhas only. Do Adrevi Chikitsa, no ama padana for Manovahasrodhas by any Balladaka. No. You can do ama padana in Manovahasrodhas only by Dhi Dhairya Atma Vijnanam. Dhi Dhairya Atma Vijnanam is told as the medicine in Ashtanga Sutradhanam first chapter. Even before he is telling about any Unmada, he is telling Atma Vijnanam is the last medicine. Atma Vijnanam means I know my merit, I know my demerits. Atma Vijnana, I know only this much, but I know this much. You know the difference? I know only this much. I am telling. Dr. Gopakumar with the double MD PhD telling, I know only 1 milligram of Ayurveda. I know only 1 milligram of Ayurveda, and I am very happy with that 1 milligram of Ayurveda. That is my compromise. So learn Ayurveda to satisfy your internal quest, and then you will naturally feel you are progressing. Ayurveda is not a science for money. It will give you everything, and you know it will be giving the ultimate happiness. Why I am spending this much of time in front of you? With all my internal diseases, with all my travel and all my problem, only because I am talking with Ayurveda. So my humble thanks to all of you who spend your valuable time here. My unconditional thanks to my Harish Doctor, who is just like my friend only, my brother only. Pavan Kumar sir, that much of relationship is there very long back. And Adulji, today only we met for the first time. So I am thankful to all of you. I very well know this time will be measured in your future life with no tamoguna, no rajoguna, ultimate sattoguna. Ignorance is tamoguna, initiation is rajoguna, continuing and sustainable is sattoguna, tamasoma to jyotirmaya. And I can tell you only one thing, learning Ayurveda itself is igniting a light. Once the light is there, you don't need any artificial light. The internal light itself is enough. So learn Ayurveda, love Ayurveda, live Ayurveda. Thank you very much.